Indication:
Remicade, Infliximab, can reduce signs and symptoms and induce and maintain remission in adult patients with moderately to severely active Crohn's disease who haven't responded well to other therapies.
Selected important safety information. Remicade can lower your ability to fight infections. Serious and sometimes fatal events can occur. There have been reports of serious infections, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that have spread throughout the body. Lymphoma, including a fatal kind called hepatosplenic T-cell lymphoma, and other cancers have been reported in children and adults taking Remicade. Some people with heart failure should not take Remicade. Other serious side effects reported include skin cancer, hepatitis B, liver injury, blood problems, allergic reactions, nervous system problems, or lupus-like syndrome. To learn more about these and other risks, please read or watch the important safety information video and read the medication guide available on this website and talk with your doctor.
Here I was like 20 years old, in Italy, trying to live out this, dream life that I had of being an artist and learning about art in Italy. And I couldn't even get out of bed. I couldn't even make my art about anything else except for being sick. And so it just affected my day-to-day existence. So I came back in December. I was so sick. I didn't want to leave Italy. I had been planning it for so long, and I just couldn't do it anymore. And so I had to go home, and my doctor gave me the option of Remicade. When I first discussed with my doctor about being on Remicade, we talked about it not being foolproof, and it may not work, but it may work. And so some of the benefits of it working are that it might take the blood away, and that, the risk of it not working is that it may not, and I may not feel better, and I may have a reaction to it, and it may not be the right medicine for me. It was something completely different than taking a pill every day and taking a suppository. It seemed like it was going, straight into my bloodstream, and I felt like it was going to work. So I made the decision to try Remicade, and I had no idea right before I made that decision if it was going to work or not, and if it didn't work, if I was going to go back to Italy or not. So now I've been on Remicade for almost 8 years. My infusions are very regular. They're every 8 weeks. At about seven and a half weeks, my body starts to tell me that I'm ready. And I go to my gastroenterologist's office. They do it right there. My husband always comes with me. Sometimes I'm just not really in the mood to do anything, and so I don't read or anything like that, but he's just there, and we hang out and chat, and it takes about 3 hours. 6 times a year is incredibly appealing for me because it seems so few compared to taking boxes and boxes of pills and, all of these things every single day of your entire life. To know that every 8 weeks you're going to go in and you're going to feel good for the next 8 weeks. So that's just an amazing discovery that they came up with something that's so few times a year. After the very first time I had Remicade, there was no blood. And that was how I knew immediately. I didn't necessarily feel better immediately. That took a little bit of time, but the blood was my indication that the medicine was working. I feel like this disease doesn't define who I am now. Now I'm an artist, and that defines who I am. And my art isn't about being sick, because that's not what I feel every single day. And so it's just something that I have on paper, this disease, and I feel it every once in a while, and I go in for Remicade every 8 weeks, but that's such a small part of my life now. My best advice for somebody who's considering an infusion of Remicade is try it.
Important safety information. Only your doctor can recommend a course of treatment after checking your health condition. Remicade, Infliximab, can cause serious side effects such as lowering your ability to fight infections. Some patients, especially those 65 years and older, have had serious infections caused by viruses, fungi, or bacteria that have spread throughout the body, including tuberculosis, TB, and histoplasmosis. Some of these infections have been fatal. Your doctor should monitor you closely for signs and symptoms of TB during treatment with Remicade. Unusual cancers have been reported in children and teenage patients taking TNF blocker medicines. Hepatosplenic T-cell lymphoma, a rare form of fatal lymphoma, has occurred mostly in teenage or young adult males with Crohn's disease or ulcerative colitis who are taking Remicade and azathioprine or 6-mercaptopurine. For children and adults taking TNF blockers, including Remicade, the chances of getting lymphoma or other cancers may increase. You should discuss any concerns about your health and medical care with your doctor. What should I tell my doctor before I take Remicade? You should let your doctor know if you have or ever had any of the following: tuberculosis, TB, or have been near someone who has TB. Your doctor will check you for TB with a skin test. If you have latent, inactive TB, you will begin TB treatment before you start Remicade. Lived in a region where certain fungal infections like histoplasmosis or coccidioidomycosis are common. Infections that keep coming back have diabetes or an immune system problem. Any type of cancer or risk factor for developing cancer, for example, chronic obstructive pulmonary disease, COPD, or had phototherapy for psoriasis. Heart failure or any heart condition. Many people with heart failure should not take Remicade. Hepatitis B virus, HBV infection, or think you may be a carrier of HBV. Your doctor will test you for HBV. Nervous system disorders like multiple sclerosis or Guillain-Barré syndrome. Also tell your doctor if you use the medicines Kineret, anakinra, Orencia, abatacept, or Actemra, tocilizumab, or other medicines called biologics used to treat the same problems as Remicade. Are pregnant, plan to become pregnant, are breastfeeding or have a baby and were using Remicade during your pregnancy. Tell your baby's doctor about your Remicade use before the baby receives any vaccine because of an increased risk of infection for up to 6 months after your last dose of Remicade you received during your pregnancy. Recently received or are scheduled to receive a vaccine. Adults and children taking Remicade should not receive live vaccines or treatment with a weakened bacteria such as BCG for bladder cancer while taking Remicade. What should I watch for and talk to my doctor about before or while taking Remicade? The following serious, sometimes fatal side effects have been reported in people taking Remicade. You should tell your doctor right away if you have any of the signs listed below. Infections like TB, blood infections, pneumonia, fever, tiredness, cough, flu, or warm, red, or painful skin, or any open sores. Remicade can make you more likely to get an infection or make any infection that you have worse. Lymphoma or any other cancers in adults and children. Skin cancer, any changes in or growths on your skin. Heart failure, new or worsening symptoms such as shortness of breath, swelling of your ankles or feet, or sudden weight gain. Reactivation of HBV. Feeling unwell, poor appetite, tiredness, fever, skin rash, and/or joint pain. Liver injury, jaundice, yellow skin and eyes, dark brown urine, right-sided abdominal pain, fever or severe tiredness. Blood disorders, fever that doesn't go away, bruising, bleeding, or severe paleness. Nervous system disorders, numbness, weakness, tingling, changes in your vision, or seizures. Allergic reactions during or after the infusion, hives, difficulty breathing, chest pain, high or low blood pressure, swelling of face and hands, and fever or chills. Lupus-like syndrome, chest discomfort or pain that does not go away, shortness of breath, joint pain, rash on the cheeks or arms that gets worse in the sun. The more common side effects with Remicade are respiratory infections that may include sinus infections and sore throat, headache, rash, coughing, and stomach pain. Psoriasis, new or worsening psoriasis, such as red scaly patches or raised bumps on the skin that are filled with pus. Please read the medication guide for Remicade available on Remicade.com and discuss it with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.